Hey, Danny Matta here, founder of PT Biz, and today we are going to talk about one hack to improve your sales conversion rates, especially if you have staff, PTs that are struggling with this. So over the last, 11 years, I've had a chance to start clinics, grow clinics, as well as help a lot of entrepreneurs, in particular on the sales side. And recently, I was having a conversation with a clinician that was struggling with one of their staff members. This was a newer clinician that they had brought on. This was a new grad at that, right? So they didn't really have a lot of reps outside of their internships. They did their rotations, and they were really struggling with sales. Now, most people have some sort of plan of care that they put together and present as an option that people have to solve the problem that they have at their initial visit. Some people, maybe that's a 2-visit option where you can sort of do the assessment number one, and then they come back and you can make a decision about prognosis and plan of care of what people want to do after that. There's a number of ways to do it, but either way, at some point in time, either you or your staff member is going to have to tell somebody, here's what I need from you. Here's how much time, here's how many visits, here's the prognosis based on the injury that you have shown up with in my office. And that's usually tied to a certain amount of money. Now, for those of you that are new to starting or running a clinic, you are dealing with this right now. You're dealing with the fact that you probably feel uncomfortable with the money conversation, because we don't have to do that in a hospital. I didn't have to do that in the Army. We don't have to do that in clinics. But when you go out on your own and you decide in particular to go in the cash-based route or even hybrid, because you're going to have to talk to people about their deductibles, the co-pays, and all of that. But on the cash-based side, you're completely kind of just talking about, here's what it costs to work with us. And that can have a big price tag associated with it in the mind of your staff, clinicians, or yourself, right? And for me, this was very challenging. I very vividly remember I charged $175 a visit, and I wouldn't sell any packages for a very long period of time. I wouldn't have any option for people to pay for multiple sessions or a plan of care all at once until probably a year and a half in. And my very first plan of care option for people was 3 visits. Okay, so like $500, $525 is what it costs. And that was my first plan of care. And I'm probably not making a long-term change in almost anybody in 3 visits, let's be honest. I'm probably more than anything just making a symptomatic change, which is not what we're going for. So getting over the fact that you feel uncomfortable talking about the monetary side of it is something that everybody has to deal with. You're gonna have to deal with it as an owner, and then you're gonna have to help your staff deal with it, because the fact that we help people do things that they enjoy doing and we help get them over injuries and back to activities they like, there's a certain amount of personal satisfaction associated with that. Many of us would work with people for free if we could, if we didn't have, if we didn't have to make money. We get a lot of personal satisfaction. I mean, it feels awesome to help somebody get over an injury and back to stuff they like to do. So with that though, we feel even worse when somebody has to pay us for that. And if they have a hard time affording it, it makes us feel even worse, because we want to desperately help them and they need help, right? And that puts us in this really challenging position. But to run a business, we have to get past the fact that, yes, we may like this so much we do for free, but it's very valuable and you need to charge what you're worth, in particular to be able to run a business and be able to pay salaries and have benefits and all the things that we want to do as business owners. So one little hack that you can implement for yourself or for a staff clinician is to really think about this as, forget about the plan of care cost. Forget about the per session cost. Focus completely on the prognosis. Imagine that you're in a situation where like it's literally free or money's not an issue, right? It doesn't really matter. You're just going to present them with the plan of care that's appropriate for their injury. And this is exactly what I would say to a young clinician. This is exactly what I told this client of ours that was dealing with this problem. Is I said, you've got to talk to them based on what they know, which is how to get somebody better and how to diagnose something, give somebody a prognosis in terms of what they can expect, duration of time it's going to take, number of sessions they may need to come in, things of that nature, in order to get them the outcome that they want, and be agnostic to the cost. right? Just remove yourself from it. Don't even think about that. So if I was to come in, unless I have chronic back pain and I have an acute bout on chronic issues that I've had for years, is that something that you think I'm just going to see somebody one time for? Is that something you think you're going to see somebody for a year for, right? Like there's going to be a period of time and a number of sessions that would work within that time that's going to be appropriate for the injury that you see. If I see a kid who has a grade 1+ ankle sprain that has no history of any sort of ankle issues previously, that's an active soccer player, am I going to say that I need to see this kid for 3 to 6 months to resolve this acute injury? Absolutely not, because it's not congruent with my clinical assessment. And I will always tie what I recommend that somebody does to what I need clinically to get them the outcome that they want. And if you can be agnostic to everything else and just say, this is what you want, this is how much I need from you as far as time or sessions or however you're breaking it up in order to get the outcome that you're telling me that you want. And for it to not sort of halfway get you there, to just make you feel better temporarily, and then this comes back. Or maybe it comes back even worse because we never really resolved the problem and you're still in somewhat of a weakened state and we have this secondary injury that's even worse. So if you can teach to the clinical side, which is what they've been trained on, which they feel far more competent with, and not on the sales side, right? Because when we talk about clinical sales training, that is a tough thing to do with a staff member that is not money motivated, that doesn't own the clinic, that doesn't feel comfortable talking about money. They just want to help somebody get better and they don't want to work in a high volume clinic. So if you can break it down and say, just base this on the prognosis, that's it. All I want you to do is that. And if it's, hey, I need to see you for 10 sessions over the course of this duration of time, this is like how many visits I need to see you to get this outcome that you said that you want. That's what you're looking at, to make sure we get you in a place where this never comes back again. You understand how to manage this and we get you the performance level that you're looking for, period. And then be quiet. And if you have a printout that shows exactly what options you have, and they can just point to the one that makes the most sense and make it as simple as, clinically, based on my experience, based on the number of people that I've worked with, based on the assessment we have today, here's what you're looking at and here's why. Tissues heal at this rate. First, this is going to happen. Then we're going to work on this. And then we're going to do this. And then we're going to expose you back to these movements and then you'll be back to doing the things that you want to do. It's going to take this long, or I need this number of sessions. Leave it at that. And if you can have them be comfortable with the discomfort of not talking whenever they present somebody with a prognosis, that's the hardest thing you're going to have to work on, because you're just tying this back to something they already understand and they feel confident about that. So let them make the prognosis, let them make the diagnosis and prognosis, tell them what they can expect, and then just have them let that person make a decision. Because they may say, that sounds great and that is what I want, but at this time, I can't do X, Y, and Z, right? And that is, frankly, a small percentage of the people you're going to talk to if you're doing a good job of educating them. Because obviously they're there because they want to solve a problem. You're being honest about how long it's going to take. And for them, now this is an open, honest discussion where they can say, well, I can't do that. Can I do this financially, whatever it might be, which in my experience is very, very small percentage. That's what we think is going to happen more than anything else. It's what freaks people out whenever they have these discussions. But more often than not, it's literally, okay, if that's what we need to do, let's do it. Because if you're clear about what's going on and they feel comfortable that you're the person that can help them and they're in the right place, people are not afraid to make an investment in themselves as long as they have clarity on what's going on. And they have an honest person in front of them that is doing the opposite of what the medical system typically does. Think about the average medical experience that somebody has. It's fragmented. The communication is not clear. They have no idea what they owe. They maybe aren't sure like how long things are going to go on, or if they need to go then see another specialist and do these diagnostic tests that probably they don't need. All of these things, it's one of the reasons why people avoid going to the doctor. Like, and this is something that, it's very proactive to do so you don't have, worse problems that pop up, but yet people still avoid this because they don't like the discomfort of the medical environment, the healthcare system that they have to deal with. And damn, if you can be opposite of that, clear, present, listen to them, understand what they want, help them achieve the thing that they want, it's not hard to sell that. You just have to be confident enough to understand how you relay that to them is a big chunk of it. Because if you are talking a ton and you talk them out of it, it's like, well, you could do this, or like, I don't know, maybe you can't afford that. It's fine. We can do this or this. Like, the more squirrely you act, the less faith they have in you, because it's a strange thing to see somebody who's a subject matter expert as a clinical professional not have a defined goal or idea of like what is going on and how long it's going to take and what you should do. And you lose that power whenever you talk people out of things and you get uncomfortable around price and what they need to actually do to get the outcome that they want, because money makes you feel uncomfortable. So if you remove the money and you just focus on what they actually need clinically, and then be quiet and let them make the decision of if they trust you enough, if you're clear enough that they want to invest in themselves to be able to get the outcome that they want. Because we know what we provide is very valuable. They obviously can feel a big difference between what they've traditionally seen and what they see now. It's more of a concierge level of education and access to a provider that a lot of people are looking for. And that's worth a lot more than you think. So stop tying what you're doing to the cost and start tying it to the actual prognosis that you come up with based on your thorough examination and listening to what they say that they want. And your close rates will go up. And if your staff focuses on this, your staff's close rates will go up as well. And they will feel far more comfortable with the very end of a visit, which is what scares most people the most about an evaluation, is having to do the sales process. They don't have to do the sales process. They just have to make the diagnosis, deliver the prognosis, and let that buyer, let that client, patient make a decision about what they want to do.